Within the same surgery, is it possible to alter the external structure of the nose, so the appearance, as well as fix the internal structure, such as nasal deviation or breathing problems?
Yes, of course. That's why the importance of choosing the right surgeon for the right surgery. For nasal surgery, it's very important to choose a surgeon who is familiar with anatomy and physiology and the pathology of the nose. So usually nose surgeons are the best surgeons to do the rhinoplasty and the functional nasal surgery in the same times. Among ENT surgeons, only 2% usually the surgeons who are really experienced in doing the nose reshaping, the rhinoplasty. This applies also for the plastic surgeons. Only maybe 2% who can do the cosmetic appearance of the nose only. Maybe plastic surgeon very good in liposuction, abdominoplasty, and breast, but I mean, when it goes to the nose is the highest degree of subspecialty. So you need always a very familiar surgeon with the anatomy, with the physiology, with the pathology of the nose, with the structure of the nose. A surgeon who has a very long background in dealing with the nose, a surgeon who has a very long experience, massive experience, and who has done thousands and thousands of cases. In our work, in our experience, 90% of the patients really have some degree of blocked noses. Mainly who lives in this part of the world, because in this part of the world you have the desert, you have the ocean, and you have the high temperature and the use of air conditioning all over the year, every day. So this creates a case of congestion, continuous congestion and blocked nose all the time. So in almost 90% of our patients, we need to do the rhinoplasty with the correction of the deviated nasal septum and the reduction of the size of the turbinate by means of either doing laser or ultrasonic or coblation, or by trimming or making the turbinate slightly smaller, trimming portion of the turbinate, removing almost 30 or 40% of the turbinate, which is really the best in order to give the patient very long-term results. So that's the importance of choosing the right surgeon for the right surgery, a surgeon familiar with the cosmetic and the functional structure of the nose.
Does this prolong the surgery, or could it also be done within 60 minutes and under local anesthesia with sedation?
The maximum time of our surgery is 50 minutes, which includes the cosmetic and the functional. All our surgery, we have about 1,000 cases all recorded. We did not cut or remove any second of the procedure. The maximum time of our surgery, which involves function and nose reshaping, does not exceed 50 minutes.
It's quite amazing to understand that you don't actually trim any of your surgical videos, that a surgeon or even a patient can watch real-time, second-by-second surgery. This just represents your confidence and your massive experience.
30 years experience and strong academic background also.
Thank you, Dr. Bizrah, so much for your time today.